Bonnie is a 12-year-old otherwise healthy D-sex female Queensland Heeler cross. The extraction is performed by myself, Dr. Anthony Kiefer of North Coast Veterinary Specialists and Referral Centre on the Sunshine Coast in Queensland, Australia. This is a pre-operative intraoral radiograph of tooth 404 showing lysis at the apex of this tooth associated with pulp necrosis and apical periodontitis, the circled area. Prior to starting the procedure, a cuffed endotracheal tube is placed and a pharyngeal pack is positioned to protect the oropharynx from any debris. A right side intraoral approach caudal mandibular nerve block is then performed. Periodontal probing is performed around the tooth to be extracted to rule out any periodontal pocketing, and a sickle explorer is used to demonstrate the complicated crown fracture. A horizontal intrasulcular releasing incision is made around the tooth to release the gingival attachment to the tooth. The vet tome is introduced at an angle onto the mesial surface of tooth 404, allowing the tip to follow the periodontal ligament parallel to the tooth root. A side-to-side action is used as the vet tome blade tracks along the periodontal ligament. It is imperative that the operator support the jaw whilst the vet tome is in action. The vet tome is operated by a foot control and should not be used for longer than 10 seconds at a time. The vet tome's foot pedal is then released and the blade withdrawn with the same side-to-side action. The vet tome blade can now be reintroduced onto another area of the tooth, eventually working around the circumference of the tooth. The fine vet tome blade is flexible so it can follow the curvature of the root. The vet tome can be used on all surfaces of the tooth with safety. This is an advantage when compared to traditional dental elevators that can slip when used on the vestibular or the buccal surfaces of the tooth, with the possibility of causing iatrogenic damage to the patient or to the operator. The operator can place the blade back into areas already luxated and thus get further along the root. If there is resistance to this, the blade can be changed to the fine blade to allow for further advancement along the root. An IM3 winged elevator is now introduced at various insertion points into the spaces created by the vet tome. Please note that there has been no vestibular flap raised, nor vestibular bone removed to assist in the extraction of the mandibular canine. An assessment of the tooth's mobility is now made, and a decision as to whether further elevation is required, or it is now appropriate to apply extraction forceps to the tooth. The extraction forceps are applied as far apically along the root of the tooth as possible, which minimizes the chance of root fracture. Canine teeth tend to be more oval in cross-section as compared to premolar teeth. Thus, the extraction forceps are used to move the tooth in a mesial or rostral direction and to hold the tooth for a period, allowing any remaining periodontal ligament fibers to tear. A force is then applied in a distal or caudal direction with the same desire of tearing periodontal ligament fibers. It is imperative that the jaw be supported with the operator's other hand during these movements. When the tooth has been delivered from the alveolus, an inspection of the tooth is performed to look for any root fractures or other pathology associated with the tooth. A post-operative radiograph is taken to confirm complete removal of the tooth with no iatrogenic damage to surrounding bony structures or neighbouring teeth. A bone curette is then used to debride any soft tissue or other debris from the alveolus or the socket. Sterile saline is then used to flush out any debris from the alveolus. An inspection of the bony walls of the alveolus is performed prior to suturing of the alveolus with 4 zero-absorbable sutures. It is imperative that a stable blood clot forms within the alveolus to allow for the healing process to begin. Written client instructions on diet, oral hygiene advice, wound and pain management should be given on the patient's discharge from the practice. It is also advisable that the extraction site be re-inspected at a subsequent review appointment. IM3 Vet Tome offers a paradigm shift in the way that we as veterinarians extract teeth in our patients. It is certainly less invasive than traditional surgical extraction techniques. Complications such as jaw fracture, damage to neighbouring teeth, or soft tissues will be minimised when the Vet Tome is used correctly. In my opinion, the IM3 Vet Tome offers a game-changing approach to tooth extractions in our companion animals.